Okay, thank you everyone. It's really great to be here. This is probably the largest audience I've ever spoken to at once, so bear with me. We're here to talk today about some of the issues around cannabis and occupational health and safety, which I know all of you probably think is quite a sexy topic. Hopefully I'll bring you on board. So first things first. Our disclosures. We just want to note that we have received funding from the Workers' Compensation Organization in British Columbia to conduct a systematic review on drug use and workplace safety outcomes. And the Institute for Work and Health, where we're based, operates with support from the Ontario Ministry of Labour. However, the Institute does maintain separation and independence from the ministry in the research that we conduct. So the objectives for today will be to describe the state of the evidence on cannabis use among Canadian workers and the effects on occupational health and safety, to explain the importance of the nature of a worker's job in considering the potential risks of cannabis use, and to describe some of the issues that practitioners may consider when workers are using cannabis, and that's where Andrea will come in. So first of all, why do we even need to think about workers in the context of cannabis use? Well, partly because of high-profile cases such as this. So this was an accident that had occurred in Ontario on Christmas Eve in 2009. So 5 workers boarded a swing stage to work on repairs to a high-rise in Ontario. The swing stage collapsed, and they plunged 13 stories, and 4 died. Toxicology results afterward revealed that 3 of the workers had cannabis in their system, including the supervisor who apparently had consumed just prior to boarding the stage. And while there were a number of other safety issues, such as the fact that none were wearing lifelines, the implication, of course, is that cannabis may have contributed to their deaths. And with legalization on the horizon, we've been hearing more and more from employers about their concerns about how legalization will impact their workplaces and how they're going to manage it. So last year, the Human Resources Professionals Association released a report after surveying 650 HR professionals from across Canada. And they found that the top 5 concerns around cannabis use among workers really centered around the safety of workers who consume and operate motor vehicles and heavy machinery, the decreased work performance and attendance issues that may result from use, as well as concerns about what to do when someone is caught using at work or is found to be impaired at work. And so this is certainly something that the occupational community is profoundly concerned about. And I think it's also important to note that workers make up a large proportion of our population. So in Canada, we have approximately 18.5 million employed residents. We also spend most of our waking hours at work or commuting to and from work. And of course, expected working life has also increased in recent years. And so the opportunity for cannabis-related impairment to spill over into working life does exist. But one question is, what do we actually know about cannabis use and impairment patterns among Canadian workers? Turns out we don't really actually know a lot. So up until recently, the best data that we've had was from Statistics Canada surveys that could be used to estimate overall use of cannabis use among workers. And based on these data, approximately 16% of workers in 2015 reported use of cannabis in the previous 12 months. And 6% reported weekly or more use in the past 3 months. But the key to remember is that this represents overall use. So this doesn't give us any information on when they were using it. Were they using it in the hours leading up to a work shift? Were they using it at work? Were they using it after work? Was it a combination? And it also doesn't tell us about impairment at the workplace. So in December of last year, Health Canada released the results of the Canadian Cannabis Survey, which Hanan spoke about yesterday. And this survey finally started to ask some questions about use in relation to the workplace. And what they found was that 21.5% of past year cannabis users reported using cannabis to get high before or at work with some degree of frequency, including 8% who reported weekly or daily use of that nature. And while I think this is a wonderful first step forward in this area to try to understand cannabis use in workers, I think it really just starts to scratch the surface about the kind of information that we need to really understand how cannabis is being used by workers and how it's being perceived by workers. In terms of the extent of use of cannabis for medical purposes at work, we don't currently have any population level statistics that I'm aware of. I will note that the survey I mentioned of HR professionals last year found that 11% of the HR professionals surveyed reported having to make accommodations for an employee who was using medical cannabis. But that likely underestimates the prevalence of workers in Canada who are actually using cannabis for medical purposes at work. So I think when it comes down to it, we don't really know a lot about the extent of cannabis use among Canadian workers. And I think going forward, we certainly need a little bit more baseline information in this population so that we can gauge whether any changes are occurring following legalization. So I think some of the information that we need is, again, trying to understand how workers are using it in relation to their work. Is it predominantly before work? Are they using it on their breaks? Are they using it during their work tasks? Are there differences in prevalence of use across occupational and industrial subgroups or across characteristics of the work environment? Why are they using it? And does that reason for use have any relation to the workplace? So are they using it to potentially deal with a stressful work environment? Are they using it to manage pain so that they can actually function at work and do physical tasks? To what extent are they using it before engaging in hazardous work tasks? We don't really know. What are their perceptions about the risk of workplace use and impairment? And what are the current norms in today's workplaces and the culture in today's workplaces around cannabis use, and how readily available is it in the workplace? So luckily, we've received some CIHR funding recently, and we're aiming to conduct a special survey of workers across Canada and across occupations and industries that we're hoping to put out soon into the field. This is a project that Andrea is involved with, as well as Mark and a couple of other colleagues. So hopefully we'll have some of those results to share later this year. So then, apart from the extent of use, which we don't really know a lot about, one of the key issues, of course, is around what are the effects of cannabis on occupational health and safety outcomes. Well, we know that cannabis can have adverse effects on a number of cognitive and psychomotor domains. So it can affect memory, concentration, it can slow reaction times, it can affect time and space perception. And of course, the concern here is that impairments in these domains could have safety repercussions at work for those who are engaging in hazardous work tasks, and could also have adverse effects on work performance. So what does the literature tell us then about the effects specifically on workplace outcomes? Again, unfortunately, the answer is not a lot just yet. So a review that was published in early 2017 by the National Academies of Sciences, Engineering and Medicine identified 6 studies, and their conclusion was that there is insufficient evidence to either support or refute an association between non-medical cannabis use and occupational injuries. However, this wasn't a systematic review, and they focused on studies that were published since 1999, and they only looked at non-medical cannabis use. So we've been, Andrea and I and some colleagues at the Institute have been working on a systematic review to examine the relationship between a select group of drugs and the risk of workplace injuries, deaths, and near-miss incidents. And this includes cannabis. We were looking at cannabis, and both medical and non-medical purposes were eligible for our review. So far, we have screened a ridiculous number of studies, so over 20,000 studies, and we've identified approximately 20 studies right now that look at the effects of cannabis, though I will say that those numbers aren't yet final. And we're just now at the point of extracting the data for our evidence synthesis, so I don't have the findings yet, but I do have some preliminary impressions of the quality of the studies in this literature, and there are considerable methodological issues that I think we need to think about when we're considering the findings. For instance, many of the previous studies used really problematic study designs that make it really difficult to draw any sort of conclusions about causation. So for instance, they use things like case series that don't have any controls. They use cross-sectional surveys. In many cases, cannabis wasn't separated out from the effects of other illicit drugs. So it's really difficult to disentangle the unique effect of cannabis on risk. The timing of use in relation to the outcome, the accident, was often unclear. And from these studies, it's certainly really difficult to know whether workers were actually impaired at the time of the incident. Many studies also didn't adequately account for confounding factors, such as the use of other impairing drugs. So it does give us pause, but we're hoping to delve a little bit further into this and again have some findings later on this year. There are also a number of studies that have demonstrated an adverse effect of cannabis on other workplace outcomes, so things like job performance, attendance at work, though the findings aren't always consistent. And I will say that many of the limitations that we're seeing in the injury literature really apply here as well. And so overall, it doesn't really seem that we have robust evidence on the effects of cannabis on workplace outcomes to date. One thing I will say is that when it comes to considering workplace safety in the context of cannabis use, not all occupations are created equally, and I think certain occupations are likely more problematic than others. Oh, it's not working. Oh, there. So you may have heard the term safety-sensitive work, and essentially that's defined as a job that, if not performed safely, can cause significant harm, either to property, to the environment, to the employee, or to others in the work environment. And so there's no clear delineation of what safety-sensitive work is or not, but some examples can include things like operating motor vehicles and machinery, sharps work, working from heights. Certain industries are also often considered safety sensitive, so transportation, healthcare, manufacturing, mining, construction. And these are just examples, but when we do talk about concerns around cannabis use in the workplace, employers in these industries in particular are often the most vocal about their concerns, and rightfully so, because these workers really do need to be present and unimpaired to be able to perform their job duties safely. So I'm not going to go too much into this, but there is this sort of other category of work that we're starting to hear about and what they call decision critical work. It sort of falls between safety sensitive and not safety sensitive, this in-between group. And again, this is sort of a group of workers that if they don't perform their job well, it can have significant repercussions, and not necessarily the catastrophic safety consequences of safety sensitive work, but significant repercussions nonetheless. So some examples that have been given for this sort of group are people like teachers, lawyers, business executives. So this may also be an important group to consider when we think about the risks of cannabis use. So the burning question is, what can we expect after legalization among the working population? Well, certainly, as I mentioned, employers are very, very much concerned about legalization leading to an increase in workers coming into work impaired, and then an increase in workplace accidents and performance issues. And many really do not feel adequately prepared to deal with these issues in a post-legalization environment. So for many employers, there is a lot of anxiety about the unknowns. And we can't even really look to the US jurisdictions to see what their experience has been like, because there actually, as far as I'm aware, hasn't been anything published as of yet that indicates whether use among workers has increased or changed at all following legalization, or whether workplace outcomes have changed since legalization. I will say, though, that despite all of what I've been saying, one thing I think is important to note is that this isn't a new issue. Cannabis is being used today in Canadian workplaces. We just don't know to what extent that's actually happening. And workplaces are already dealing with it to some degree. So in terms of how things will change after legalization, I think only time will tell. But I do think that the important thing to do moving forward is to educate workers and make sure that they're aware of the potential risks of use, particularly those in safety-sensitive positions. So what won't change? Under occupational health and safety legislation across Canada, currently, employers have a duty to provide a safe work environment, and that means ensuring that their workers are unimpaired. Likewise, employees have a duty to perform their work safely, and that means not being impaired at work. And so just because cannabis becomes legal doesn't give employees free license to consume at work or be impaired. Currently, there have been no changes in the law that is permitting more widespread random drug testing, which has been a pretty contentious topic, but that could also change in the months to come. So we'll have to see. Another thing that really won't change: workers who are using for medical purposes after legalization, they will continue to have to be able to document that they have medical authorization in order to receive accommodations in the workplace. So I think from there, I'm going to turn it over to Andrea so she can start to talk briefly about some of the issues to consider among working patients.
Okay, so you saw that there is not a lot of evidence for a lot of things, but we still have patients for whom we authorize cannabis. I certainly do, and I'm a chronic pain specialist here in Toronto, and we need to mitigate those risks. And not only for the patients that we are authorizing cannabis, cannabinoids, but also we have an opportunity to educate and inform all of our patients who come to us and they're using recreational marijuana. Because if we don't ask if they're using, then we will not know how they're using. So I'd like you to remember, this is going to be very, you should be doing this already for all of the patients that you do, documenting your conversation. And these 9 things are the topics that I would recommend for everyone to do. For the patients that you authorize cannabinoids or prescribe, or for the ones that you know are using recreationally, and you have an opportunity here to do some harms reduction regarding to their work. So for example, asking anyone, do you use it outside of that I don't know, I'm not prescribing this to you, I'm not authorizing, but are you using recreationally? Or are you using to relieve some symptoms? And if they say yes, what you document in the chart is very important because there is a medical legal aspect outside of all of this. And the lawyers, I don't know if there are lawyers here in the room, but the lawyers would love to have cases where they can win, and this is an easy win. You know, the patient is impaired, the patient causes your patient or anyone causes an accident. Well, this is an easy case for lawyers. Lawyers want easy cases. And guess what? The workplace will say, we told them not to use, so they're kind of free. The patient or the user will say, well, I was using this, I did not know, nobody told me, or I did not know they have a union to defend them, and they are outside. But then who is going to be blamed? The doctor who knew and didn't do anything. So if you document those things and you educate the patient, that's a great opportunity for harm reduction. So what are the things that you need to document and ask? What is the purpose of you using this? So if you're prescribing, authorizing, of course you know why you're doing this, what is the medical indication, but some who are using outside of your authorization, they may say, well, I'm using this for anxiety, and then you document why they're using this. Is it helping? Because if it's not helping, let's look for other things that may be more helpful. What time are you using? Do you use before you go to work? Do you use at work? So you have an opportunity to tell them, why don't you use after work? So you don't need to go to work impaired. What about the method of consumption? We know that smoked, any inhaled forms, they last, we have to say, between 4 or 6 hours. But if it's edible, then we need to ask the patient to take longer time. So I had a lady, she was using oils, ingesting oils, and she told me exactly. She knew she was impaired for 11 hours. She knew exactly. So if we ask the patient, how long you know you are impaired, they will know, and that's what you document in the chart. How frequent they use, it might only be on the weekends. It may not be, they say, no, I don't use this on weekdays that I have to go to work. What is the potency? Do they know how much they're using? What is the concentration of THC? And then you may have an opportunity to tell them to use more CBD, less THC. And also the use of other drugs. Do they mix with alcohol, especially with alcohol, which is so important? We know patients that use cannabinoids, they know that they're impaired. They are aware of their impairment. But if they mix with alcohol, alcohol will block their ability to realize that they are impaired, because that's what alcohol does. The first thing that alcohol gets rid of is your frontal lobe, so they don't know that they're impaired. So tell them, don't mix with alcohol and don't mix with other drugs that will potentiate the effects, especially if you're going to work. Think about the school bus driver that is driving your kids or is driving your grandkids. You don't want them to be impaired, especially when they're driving your kids to an excursion or a field trip, right? So what about the type of work? So ask your patients or your people that are across your desk, what kind of work do you do? Is it safe sensitive? Do you have an opportunity for accommodation at work? What type of, do you know that you're impaired? Do you notice impairment? They usually know, and they will tell you how long the impairment lasts. And also, if you see signs of aberrant behaviors and also signs of cannabis use disorder, then you have to take action and refer them for proper treatments. So educating the worker or the patients in front of you is an opportunity that we cannot miss. And this is about the risks that they have in the workplace. And also, what do you do? So look at the low-risk guidelines that Bernard was just telling us. If it's inhaled form, tell them to wait at least 6 hours. The College of Family Physicians of Canada, they say anywhere between 4 and 8. And the Occupational Medicine Association of Canada, they have a paper that was published by Els et al., and they are going to prepare a statement about workers using cannabis, and they say no use for any tasks that are safety sensitive. So that will be the policy. Some workplaces now, they already have signs. We are a zero tolerance. We have a zero tolerance policy, so 0 drugs, because this is all the work that is done here is safe sensitive. So, of course, there is no consensus on what is a safe window, especially for THC limits. It may depend on frequency of use, tolerance, if it has CBD or not, what is the content. There is no consensus at this point, but it's important that you document your questions and what the patient responded. When we say accommodations, so if you are in doubt, so if you have no idea what to do, it's always a good idea to contact the workplace. They usually have a nurse, an occupational nurse, they have an occupational physician, they have an HR department, and see, is there any possibility to modify, do some accommodations? And the type of accommodations may be, limitation of the work. Are they aware that they are, first, are the worker aware of those accommodations? Can they perform? Are they able to perform those tasks? If they need accommodation, is it for medical purposes? And it's a human right, because if they're using for medical purposes, they're treating a condition, so they have the rights for accommodation. And they also may need some time and accommodation to attend a rehabilitation if that's necessary. Example of accommodations, they can have modified hours, modified tasks, they can be reassigned to another position that is not safety sensitive, or they may even need some absence for treatment and rehabilitation if they are having some sort of a cannabis use disorder. So key messages. Cannabis use is not uncommon among Canadian workers already, independent of any legalization, but the extent of the use and impairment is not well understood. Robust evidence for a causal relationship between if cannabis is used causing any occupational health and safety hazards is lacking. But we know that this is much more important in safety sensitive and maybe also important in decision critical occupations. Clinical assessment of any worker using cannabis should probe the nature of what they are using, the timing of use, the type of job, the potential need for accommodations, and you have a great opportunity in front of you if that's your patient. We'd like to acknowledge the Institute for Can Health and That's our contact information. Thank you.